Cool, cool. So my first really difficult and hard-hitting question, because I like to get right to the point sometimes. So why family medicines? Why is it cool? Why are you a family doc?
All the corny reasons. I love helping people, and I love getting to know them. And I remember thinking in med school, I was thinking of what's interesting, and they send the person off and I couldn't do that. I like to get to know my patients. I have patients who I've been seeing ever since, residency, who've, followed me wherever I've been, and I know them, I know their family, I know, all about them, and it really makes things so much more rewarding.
Well, cool, cool, yeah. So just to let people know, Mary's having a little bit of some audio issues, but I think we'll be able to kind of work through that on this.
You want me to move?
No, I think we'll be okay here. So
Okay.
I will let you know if there is an issue. So
sorry.
No, it's not. No, it's not. It's not your fault at all. So let's kind of dive into this here. Let's let's talk about your coronavirus story. Wherever you'd want to start with that. So you have to tell us your coronavirus story.
Sure. So in March, it was about mid-March, right when everything was kind of going crazy, and I had a known positive contact. And with everything going on, I realized I needed to quarantine myself. And I talked to, my company, and he was great, and we transitioned to telehealth right away. So we, basically changed things super quickly. And all of a sudden, going from everybody seeing in person to everybody seeing via phone. And then a couple days after that, I noticed I started coughing, and I was walking my dog, and I thought, why am I really out of shape? And was like, oh no, I'm short of breath. And started running fevers and body aches. And thankfully, my symptoms were, much less severe than some people. I didn't end up in the hospital. I didn't end up on a vent, and was able to, work from home and, cloistered here, and was able to still, do my patients, see my patients via telehealth, and do all the messages and refills. And then when we take call for a big group, and of course that was the weekend I was on call. So I took call, and that was kind of crazy in the sense of with COVID, we were getting so many more calls. People were scared anytime they had things that they wouldn't normally call for. They were calling because, they thought they might have coronavirus. And then the other challenge was when you go to the ER, really, really trying to treat them as much as we could without sending them in, so that they wouldn't have contact, and that we were concerned, that the ERs would get full.
So yeah, I guess I want to go back to, when you were feeling sick, like when you first started having these symptoms, was your first thought coronavirus? Because we'll get into like how physicians kind of downplay everything. But did you think that, it was that? Do you think you were just overworked? Did you think that, you had a bad dinner the night before? Like, what was going through your head during that?
So I knew I'd had a positive contact, which did change my thinking a little bit. So of course I'm kind of on the lookout for symptoms, and probably, more so than I otherwise would have been. And then I'm, walking my dogs, and I'm like, oh, well, I'm just out of shape, and I said something to my husband, and he's like, no, you do farm chores. You are not out of shape. We live on a farm, and you do farm chores. You are not out of shape. You're probably actually really sick. And I was like, So, and then I was running temps to like 102, had the body aches and was like, okay, I probably have it. At that point, testing was scarce at best. And, save for people who were hospitalized, which thankfully I was not. So,
So then you just went with like,
as
clinical diagnosis. You were not tested. You're like, I got it. And then, so what is the process of like informing your boss? You're like, I think I have it, and then I'm going to stay home, or I'm going to work from home, or like, what's that like?
And we worked out a plan to allow me to still take care of people from home, which was great. And then when I got sick, it didn't really change things. I was already at home. I wasn't spreading it to anybody. So I just continued to work through.
And so describe to people how is it working from home with coronavirus, and I guess transitioning to telemedicine, all in kind of all that same time.
Well, I think the transitioning to telemedicine is probably what most of the family docs out there have been. I think one of the challenging things is, in med school, you're always taught history and exam. And then all of a sudden, with telemedicine, it's just history, or and you're trying like angle your Zoom camera like a little differently. And I think one of the big challenges we've had, particularly in a rural community, is a lot of our patients either don't have good internet, and apparently I'm causing that issue right now. So if I am, let me know. Or don't know how to do Zoom, don't know how to do telehealth. So while we're also new, our patients are new and they don't know how to do it either. So we're trying to teach them how to do this, and sometimes your patients don't have Zoom figured out, or you're trying to help them and they just can't get it, or you're spending half the visit time trying to help them figure out how to do Zoom, but you need to do Zoom because it's for a rash and you can't diagnose the rash without seeing it. So I think that change was really hard. And then and being sick, as a family doc, we've all been that whole, like, you're sick. At what point do you not see patients, and that's always a hard line because you're wanting to help, but you also don't want to get people sick. I guess the silver lining of all of this is because I was working from home, I never had to worry about that. I never was worried of, oh, I'm going to get somebody sick. It was just okay, I feel crummy. How do I plug through? Basically I would, wake up, I'd see my patients, and then I'd go back to sleep, So that's what I would do. And, but yeah, the telehealth is really, I think very quick for everybody. So it's, really quick on a dime.
So a lot of people, obviously they're concerned, they're scared of getting coronavirus, COVID-19. So describe to us, like, how long did it take to recover, and what did your recovery process kind of look like, specifically from like a physical symptom standpoint?
Yeah. So it was about 2 weeks before I was, met the criteria to be able to return to work. At the time, the criteria was like 3 days, symptoms at least 7 days since the start of symptoms, and 3 days without fever. So I still had that for, I think about a week and a half. I was intermittently spiking temps. And then finally, when I didn't, I went back to work. Pretty tired. The biggest thing, honestly, when I went back to work was just a lot of fatigue. Like, I felt okay, but my endurance was pretty low. And I basically kind of, wanted to get every night I got home and I just wanted to sleep. But the cough was a little bit lingering, but not terrible at that point. So I'd say about 2 weeks before I was, able to go physically back to work, or before I met the criteria, I guess, to not be contagious. And then probably another 2 to 3 more weeks before I was back to myself fully. Just kind of, a little bit draggy, nothing terrible, but the fatigue took a little while.
So did you, did you reveal this to your patients? Did they know that you were home having this, or what? Or
no, I just, I didn't think there was a need to, since I wasn't putting them at risk. I was home, clearly not infecting them. I didn't share that.
Okay. So how long would you take until you actually felt like you were kind of, pre-COVID status, in case people want to know?
Probably about a month.
A month? Okay. Okay. And now you're doing everything you need to do, and you're pretty much
good.
back to normal. And and then when did you go back and see patients in the office again?
It was about 2 weeks after. So I think, I was about 2 weeks after.
Okay. So let's kind of shift topics here a little bit, and then you're in rural America, and if you could describe to people, what's it like to take care of patients in rural America? What's Lebanon and Ohio like, and how would you describe where you live and where you work?
So I think rural medicine's a lot of fun. My patients are just really cool. They've got a lot of neat stories. I was doing a telehealth visit on Friday, and somebody was like, "Hey, I'm sorry, you're hearing my cows, in the background." He's like, "I'm out in the barn feeding my animals." So we got a lovely conversation about all his animals and our animals, and so that was. It's just, you get a lot of cool stories. You have a lot of people who are really nice, good people who, I think are honestly often really appreciative, because it's so much harder to find a lot of things in rural areas, and not just healthcare, but anything is harder to find in rural areas, especially healthcare. So I feel like my patients really appreciate the fact that we're there. I live in Xenia, Ohio, and we live on a farm, and so we have sheep and chickens and ducks, and which is a lot of fun, and then also gives me a lot of things to talk to about with my patients, because a lot of them, we'll share their chicken stories, and I have a couple of patients who work for vets with large animals. So they're always like, "Oh, how are the sheep?" One of my patients, God love her, she sends me postcards. But she doesn't send me the postcards, actually. She usually sends my animals the postcards. So seriously. So the first one, so we have 2 livestock guardian dogs who keep the predators and coyotes away from their other animals. And their names are Bernie and Julie. And Bernie, of course they are. And Bernie, Julie's a rescue, and Bernie, we had some issues, and Bernie had some hip issues, and so I was talking to her about them. So she sent him a get well card. It was addressed to Mary Krebs, care of Dr. Mary Krebs. And then she came again, and we were talking about how our ram is kind of aggressive, and he and Bernie were fighting, and then Bob would kind of try to ram like people. And so I was telling her this story. So then she sends Bob the Ram Krebs a postcard, care of me, and basically says he needs to be nice. So, things that you wouldn't get in, New York City or someplace like that.
And you mentioned this before at the beginning of this interview, but you cut out a little bit. Mm-hmm. Maybe talk a little bit about the unique challenges of rural medicine, the unique challenges of your patients that we talked, before this interview, especially when it comes to technology, when it comes to telemedicine, because there's huge things with telemedicine, but I know there's also some other unique challenges in rural America as well. So to share a little bit about that.
Absolutely. So a number of the challenges are, a lot of my patients have, a lot of my patients don't have internet. So Zoom or any kind of telehealth is very difficult. So one of the big challenges is, how do you do a visit, particularly like if it's a rash, and they don't have internet, or they need a lot of time to learn how to do that. So one thing I'll give a shout out to the AAFP for, helping to get telehealth covered, even on phone under temporary circumstances. And hopefully, I think one of the things we need to do is we need to keep working on that. Telehealth isn't going away. And we've found that it can be used for a lot more than it's been being used for. So I think we need to work on physician payments so that patients can still access that care that they need. And many of them really, really like it. Some of them are like, hey, I can do this without taking time away from my, I don't have to drive. A lot of my patients have transportation issues. Some of them drive pretty far distance to see me. And so they love not having to. I had a patient who, I had a telehealth visit earlier this week on. He drives an hour to see me. And he's like, hey, this is great. I just saved 2 hours from having to drive round trip, not to mention, everything else, so he was really excited. So, but I think internet issues are a huge issue. One of the other issues is, I think, healthy foods. With all of, we've all been to the grocery store recently, and, people have stockpiled and bought like 3 years worth of flour or whatever. And in bigger cities, there might be another grocery store that still has what they need. But like for my diabetics, I've seen a lot of their sugars go up. And when I talk to them, it sounds, we get to the bottom of it. They went to the grocery and they couldn't get any vegetables, they're out of certain things. And so, but they had plenty of pasta. So, then my patient's sugars are 300 and, that's a big problem. So I think a lot of it is that having trouble of them getting the things that they need when there might not be a whole bunch of other stores around. They can still get food, but they can't get the healthy food that they need.
It's interesting because, like in the urban setting, they talk about these food deserts, but it also happens in the rural setting or a semi-rural setting as well.
It does. So, I mean, granted, I have some patients who are farmers and they have plenty of stuff, which is great. But then I have a number of my other patients who, they're relying on one grocery store. And if that grocery store is out of something, then they can't get it. So I think there's definitely food deserts in urban areas, but there's also some in rural areas. And plus you can't, with everything being shut down, even farmers markets, weren't happening. So some of my patients who are farmers were saying, hey, one of them was like, hey, I got a whole bunch of dairy, of milk from my cows, but I got nowhere I can get it to. So I think there were, a lot of supply issues. And then of course everybody's, nervous and buying up things. So there are definitely, food issues in multiple areas.
Yeah, I mean, because we're at practice here, it's kind of a semi-rural, semi-suburban type of setting. And we have a farmer's market that just opened last week. And just with those concerns and the feedback that you just said, because there's people out there who have these products, and they look to these local markets who weren't meeting because of coronavirus. So that's another thing of coronavirus, but that's not something that necessarily makes the news. So hopefully opening up of these farmers markets now will make that access a little bit better. Because I go, my wife and I go there sometimes too, and we're bummed out. Like, hey, we have to just go to the store. I know that's a first world problem, but these farmers markets really serve a need, especially in rural communities.
Absolutely, and a lot of times it's the healthiest food that they can get, and so I think it's hurting the farmers. It's hurting the people who are buying on that. So that is definitely a hardship for them.
So we're talking to Dr. Mary Krebs, a good friend of mine, and we're talking about coronavirus. We're talking a little bit about rural medicine. Let's talk about now, you touched a little bit about advocacy, and how family docs really need to tell the story, tell their own story. So just to let the audience know, Dr. Mary was, interviewed for the Wall Street Journal and was on MSNBC and was on Fox News telling this same story. Share a little bit if you can, like how did that all happen? And it's because I know on Facebook and with people in our community, they were very excited for you that you were telling the story. How did that opportunity kind of, come about for you?
So I was actually talking to Dr. Ted Winslow, who was my program director in residency, who, if you don't know, he's a fabulous family doc and works with the Ohio Association of Community Health Centers. And we were just chatting. And then the next thing I know, I got an email that the Ohio Association of Community Health Centers wanted to do a story. And then apparently one of them talked to a reporter for the Wall Street Journal. And the next thing I know, later that day, I'm talking to a Wall Street Journal reporter. And then after that article came out, then I got calls from MSNBC and a couple other major news, Fox and a couple other major news networks. And it was honestly a little weird because, I'm a family doc. I am used to working with one person or maybe one person plus their family. And, this isn't my thing, but I had a good chat with a couple of family docs I know and trust. And I kind of said to one of them, I said, every other family doc would have done the same thing. We all are really work hard for our patients, and I believe that probably, most family docs would have done the same thing as I did. And so I feel kind of silly going on these. And she said, you know what, you're right. Family doc, most family docs would do the same thing, but the public doesn't know it. And we need to get that story out. And I thought about that and I thought, okay, even if I might look kind of silly and I'm not the best media speaker, I'm a family doc, and I think we need to get the story about family medicine out to people. And, our patients don't realize all the things we do. Legislators don't realize all the things we do. Insurance companies don't realize all the things we do. And so if I'm able to go on and make a difference for our specialty and our patients, then I have a duty to do that. So I did. And, I'm glad I did, because I feel like, I think we all need to work on getting this story out in whatever way we can.
One of the reasons why you're a great family doc is that, you want to be prepared, you want to know, and you really want to look good at what you did. There's a lot of family docs, out there who are intimidated by the media. They say, I don't want to talk to them, or I'm not sure what to say. What was your kind of process to prepare? And then, especially for the TV appearances, I just presume you did something like this, kind of like on your computer in your room there. What was your, did you have talking points on your computer? Like can you describe a little bit of your process about the press experience?
And I'll tell you, I totally feel that, because, this is not my area of expertise. So I was super nervous. So what I did was I called Dr. Gary Leroy, who I was fortunate enough to have as my residency faculty. And obviously Gary gets interviewed all the time, as he's, president of AAFP, and does a great job at it. So who better to give me guidance than that? So I talked to him, and he gave me some good advice of just, tell your story. We need to get the story out. Just, you're a family doc. Nobody's expecting you to be this media savvy. Just be your family doc self. And then I also tried to look at what were the points I wanted to get out. So I wanted to communicate to people that this was serious. I have a lot of patients who still think it's a hoax. And I'm trying to educate those, but I wanted to get that message out. I wanted to get the message out of, that other health issues don't go away just because of COVID. We're still dealing with diabetes and asthma and depression and anxiety, and many of them are worse because of COVID. I feel like my patients with depression and anxiety have doubled or tripled because of all of this. People are worried about COVID. They're worried about they lost their job, their financial stresses. They're worried about, their kids who are doing homeschool. So everybody's, stressed and overwhelmed. And so I wanted to get that point across. And also that one of the other things I got across in some, even though I'm very fortunate that I'm at an FQHC, I worry about my colleagues in private practice. If you're all of a sudden taking a huge hit in volume, you're not able to do, wellness checks, which is a lot of our, the patients we're seeing. You might have, telehealth we didn't know how it was going to get billed. You've got to figure out a platform for all that. I was really worried about those. And I don't think a lot of people outside the medical community realize all those issues. So I was trying to get that point across when I could. What I had set up was, I had a spot with good Wi-Fi and a computer. At one point for the Fox News interview, they were having trouble with the computer, so my husband had to hold my cell phone up.
I read that. So he was the camera guy because your computer kind of bonked out, and he was just there, just sitting for that 7-minute interview.
Yeah, basically, he's been great. Like he has, he's far more tech savvy than I am, and so he was like, "Hey, let me get everything set up," and then has been just super supportive. And then what we kind of did was we had the computer, the cell phone was like up on the counter, and then we had a list of the points that I was trying to get across in there. So that helped. And I think the other thing is that speaking to all you family docs who are listening, like if you get an opportunity, like take it. Like nobody's expecting you to be the superstar media, Dr. Gary Leroy, who can do a beautiful interview. Our goal is to show the world what family medicine is about. And I think if you're just being yourself and telling your story, I think that is what is really important. And that's what's really needed. So I would certainly say to anybody who gets a opportunity to share their story, whether it's with a legislator, whether it's, educating your patient that, oh, of course we see newborn babies, you don't need to go to a pediatrician. I'm trained for that. Or talking to a legislator about all the challenges we have and how much of a hassle it is to get our patients the medicine they need. I think we all need to be able to, share our stories whenever we can, because that's how we're going to create change for our specialty and our patients. And it's also going to help our med students realize how cool our specialty is and go into family med, because, we all know that there's a shortage of family docs, and we need more good family docs, and we need to have our students realize how cool family medicine is.
Wow. All right. That was awesome. So, time is quickly going, so I have a few more topics that I want to cover with you. One topic I want to cover is, you're a solo family doc in rural America at a FQHC. We talked about it a little bit at the top of the interview, but I just wanted to recap that again. Suppose you're talking to, a medical student or a resident or a college student, share a little bit about, being a solo family doc. What is it really like? What were the challenges? Are there some things unexpected? Just being a solo family doc. How was that, and why is it so cool? Why is it the best job in the world?
So one of the things that's really cool is that I get to see my patients, and when they're sick, I'm the one who's usually seeing them, and it's nice that it's always, they're seeing me for diabetes, but then when I was in group practice, sometimes they call in for a urinary tract infection or something else, and they see your partner, which is great, but it's really cool to always be that, that you're always getting to see them. So that's really cool. I think the hardest part, of course, is, if I'm off, it's far more challenging, obviously. So that's the hard part. I think for med students or residents, I would tell them that if, I think in rural settings, you develop a special relationship with your patients. Not saying that other people don't. I haven't practiced in every setting there is, but in my experience, I've really enjoyed practicing in a rural area. I think I get really cool patients with really cool stories, and heck, my animals even get postcards. Whereas, that's pretty cool. And I would just tell them that, hey, you really get to develop a good relationship with your patients in this way. Also, one of the neat things about an FQHC is if your patient loses insurance, I have a lot more resources to help them. When I've been in private practice and my patient lost insurance, it's like, oh gosh, how am I going to get them anything that they need? And in an FQHC, if they lose insurance, it's still challenging. If I need, to get them referred or something else, or a procedure or a test, that's still hard. But we have access to the 340B program, which helps get their meds at a much more reasonable price. We have outreach who can see if they qualify for Medicaid. I feel like we have a lot more resources if a patient is struggling, because it's so hard as a family doc when you know what your patient needs and you can't get it for them. You know that they would do so much better if they could just get this certain medication, and you can't get them because they can't afford it. So I feel like one of the really nice things about an FQHC is it really gives you a lot more resources to help your patients when they're struggling.
Let's see. Excuse me. What else I have on my list? So we can kind of start to close up here a little bit, and I'm going to ask you a series of questions here, kind of as closing thoughts, because as we talked about in kind of on our pre-interview. So what messages do you have, especially for patients in your community and everywhere else? What is your message to them about coronavirus, about COVID-19? What are you telling your patients now? Because there's a lot of stuff out there in the press, but what are you telling patients when they ask you about coronavirus now?
What I'm telling them is I tell them, that it is still out there and that we need to be as careful as we can. When I'm sending in prescriptions, I tell them to use the drive-through. I encourage them to, if they're going out, to, wear a mask, stay 6 feet away, wash their hands, don't touch their face. And then certainly for some patients, particularly my high-risk patients who, have severe COPD, they're elderly, they're on oxygen, I'm telling them, hey, you're at really high risk for coronavirus. And I talk to them about what steps they can do to get what they need without putting themselves at risk. So, the nice thing is, as a family doc, I might say, you're really high risk, but I know that your daughter lives down the street and she's, really caring for you. Why don't you have her get your groceries, drop them off on your doorstep, and then you can stay in and keep your risk down. So I've been doing a lot of education for my patients of explaining that. A lot of my patients say, oh, I don't want to wear a mask, it's uncomfortable. And so trying to help them, work through that so that they can still protect themselves and protect others.
And what is your message to family docs, family physicians, especially when it comes to things like advocacy, payment for telehealth, and being a media star as you are, some of them who are reluctant. What is your message to them, kind of as you're looking back on your experience last few weeks?
Well, I would say, one, thank you for everything you're doing, because, family medicine is a very rewarding but often very challenging job, and COVID has not made that easier. So thanks for everything you're doing. I think advocacy is critical because I think a lot of people don't realize what we do. They don't realize that we can take care of babies, we can take care of the elderly, we can do PAPs, some of us deliver babies, we can do a lot of stuff to help our patient. And I think we need to continue to educate our patients about all the things we can do. I always chuckle when patients come in and they say, well, doc, I'm here because I need 3 referrals. And when I talk to them, I'm like, well, we can take care of that. We can take care of that. And we can take care of that too. And then they leave with with 0 referrals, but they're much happier because I just took care of their 3 things, or at least started a plan for those 3 things. And they don't have to go see 3 other doctors. So I think we need to educate our patients. I think we need to be active legislatively. So I chair the Commission on Quality and Practice, and one of the big things we've been doing is working with trying to help get telehealth covered at parity. We've been trying to help independent docs with their issues, and I think getting those stories out to the legislators and working with the Academy to get our stories out is really key, because we all have things that are frustrating and we want to change, but we got to get our story out to change those. And then if you do get an opportunity, like, you know, you take it, you know, you're not doing it for you, you're doing it for other family docs and all of our patients, that we need to get the word out. So that would be my message.
What was that quote you were telling me before, that, you know, family docs are asked to help everyone else out, but we're unique in what ourselves are. I know I totally messed up that
And I
paraphrase,
might
but
butcher
what
it a
was that?
little bit, but for those of you who know Dr. Margot Savoy, she is a fabulous family physician and on the AAFP board of directors. And apparently in a board meeting, she made the comment of, you know, in all of this COVID, you know, everybody is, family docs are covering for all of these other specialties, but there's nobody who can cover for us. And I think she makes a really good point that we are able to do, our specialty is so well adapted to this. You know, we can handle babies, we can handle elderly, we're trying to educate, we have relationships with our patients. So I think we are, you know, some of us deliver babies. I think we are very, very well equipped to handle this. And yeah, I think Dr. Savoy hit the nail on the head.
And finally, so just to let people know around the world, our great Director of Health, Dr. Amy Acton, stepped down last week. And I heard, because I'm starting the rumor right now, that Dr. Mary Krebs is applying to be Director of Health for the state of Ohio. I think it's a great thing that you're doing. What is your what do you hope to do?
You know, I heard Dr. Sevilla was going to get that job. And you'd be great at it, Mike. I am not that brave.
So all joking aside, what has been your reaction to how she has dealt with this, how the state of Ohio has dealt with the coronavirus pandemic?
I think Dr. Acton has done a fabulous job, and I am so appreciative to her for her service. I am so disappointed that she stepped down. I certainly can understand that. I can understand why. I mean, you know, I certainly wouldn't want people showing up with guns in my front yard. And I can't imagine how scary that must have been for her and her family and all the harassment. And it just makes me really sad that people are, you know, we're targeting her like that. You know, her whole goal is just to keep people healthy. That is her entire goal. And she's working tirelessly and honestly did an amazing job of, you know, explaining to Governor DeWine what the threat was and how we could keep people safe. And I am so grateful to her for her service and very sad that she has resigned.
Yeah, I would definitely agree with that. I mean, did a great job. I mean, you know, she didn't sign up to do the job. I mean, you know, be the person who's going to take care of all the coronavirus stuff. Does not envy, you know, that type of life, being under the microscope. I do not envy the next person who's going to be doing that, but definitely did a fabulous job. Speaking of people who are doing fabulous jobs, you have friends who are watching us right now. Our friends, Dr. Kim Yu, she says the best part of long-term relationships with generations of families. So talking about family medicine, obviously. And Dr. Julie Wood. So she said, this is verbatim, I'm not making this up. This is on Facebook. Dr. Krebs is a pioneer of another type. She chaired the very first AFP live stream course for rural family docs. It was incredible. I hope she had time to tell us about that. So tell us a little bit about the evolution of this, and just to let people know, so that this is a totally online CME educational course that was offered. So Mary, tell us with your involvement with that and your planning, and because I heard you did the whole thing, and but tell the audience.
I did not do the whole thing. I'm sure, but
I'm giving you credit for that right now.
Let's make that very, very clear. Did not do the whole thing. So the AFP did a survey. I might be a little fuzzy on the details because some of this was before I got involved. But before I got involved, the AFP was trying to figure out a way to, you know, help reach out and do some more CME for rural docs, and somehow realized basically the idea of a virtual conference would be really helpful. This was all well before COVID, because, you know, a lot of docs are in rural areas. They might be solo. They don't have time to take away from their practice, or traveling can be a real issue. So the plan was to do this course entirely virtually. I was going to, the plan was we were going to fly myself and the rest of the faculty in and video it in Kansas City. And then of course with COVID, that changed a little bit. But so we all just, we did the videos from our homes, their offices. But it was actually really cool because we'd planned it to be virtual all along. So we'd planned a number of ways to help with community and connection. And we got a great group of faculty. And I want to give a huge shout out to the AAFP who really let me helped. I was able to really bring what I thought rural family docs needed. And I kind of had a very forward-thinking list of topics I wanted to do, and thought there was a good chance I would be told no. And they said, no, let's do it. And so we really were able to do a lot of really cool topics. We did, psychiatric emergencies. We did ADHD. We did wound care. We did inpatient medicine, some, OB care. So a lot of different topics, and they had it in that people could sign up for like this morning, and this afternoon.
Like different modules and things.
Yeah. So, we had substance use disorder, if you wanted to do that, but you didn't want to do OB, you could pick and choose what you wanted to do. And it actually went really well technologically. We didn't have any meaningful issues until like the third and final day. And you could actually see the comments from people as, you go. And I thought people are going to be upset. And people were like, oh, I thought we'd have issues earlier. This is actually pretty good, And staff, anybody who's worked with AAFP staff knows that the staff is fabulous and, takes care of everything before you can even think of the issue. So they did a fabulous job, and it was really fun, doing all that, and you still got to interact with people, and the attendance was significantly better than expected. So I was really, really happy with how things went.
So I'm going to put you on the spot here. So do you see this kind of as a trend, and how do you think the program could be even made better whenever the next one is?
I do. It seemed to go really well. So I would assume that we'll have one next year. And I think really the big thing is just everybody's getting more comfortable with the platform. I think we were all a little bit nervous of how is this going to go, because like I presented at FMX, but that's with I don't have to worry about technology very much, because if there is a technology issue, there's somebody who's just sitting there making sure everything goes right. And if I'm in at home or my office or wherever, and something goes wrong, there's nobody else there to fix it. So there's that little bit of nervousness there. So I think all of the faculty were probably a little similar to that, but everybody, really, like, you could see everybody get more comfortable. I already got some good topics that I'm working on for that, that we've kind of been thinking of for next year. And so I think it's going to go well. I think, there's always room to improve, and we'll see what evaluations and what people's suggestions are. But I don't have any big, huge areas of, this was an issue.
And my last couple of questions, they're kind of like a little bit inside baseball stuff just for the general audience, but for the AFP audience, you'll probably recognize what I'm asking here. So yesterday, was the virtual type of leadership meeting and for member constituencies and all of that. And I was able to kind of peek into some of that. What was your reaction of what you saw? And, did you think that you were able to interact as much as you could to the other participants in the meeting?
I think the AFP did a fabulous job. Of course, we all were sad about it being canceled. Totally understand why, but we all enjoy seeing our friends there and all. But I think the Academy, Dr. Ramos did a great job. All the co-conveners did a great job. It went really smoothly. I thought the NCCL is kind of a complicated, in terms of the schedule and structure, and with the breakout sessions, and they were able to do those in a really good way. I thought it went really well, and I think also it might be a good platform to get more people involved of, hey, maybe somebody's interested, but maybe not, doesn't have the time at the moment to go to Kansas City for, 3.5 or 4 days for the full conference, maybe have this, have the regular conference in April and have this conference sometime later in the year. I think it's a great opportunity to develop leaders. I think it's a great opportunity that people who want to get involved in the Academy can do that. And I think it's great that our Academy really tries to listen to all of our voices. So I appreciate that the Academy has been kind of probably very, very busy with all of these changes with COVID, I'm sure, but I appreciate that they made a way found a way to make this work.
You've been known, and I've seen you present at Family Medicine Experience in the past, FMX, and has FMX officially been canceled, or
FMX is virtual.
or virtual? So were you scheduled to be presenting this year or not, or what is your preparation process to present?
So I'm presenting on 2 topics, and I know we're kind of waiting to hear more. My guess is that it'll probably be, in some ways, the rural health course probably has prepared me very well for this, that I'm not nearly as nervous as I otherwise would be about doing the talk virtually. I think the Academy's done a lot of, already been doing a number of virtual events, and I think by the time FMX rolls around, I am confident that they will have a very good plan figured out for it. I am sad that I don't get, I think there's obviously certain things that you can't do in a virtual meeting that you can in a real live meeting. But I also understand the risks and the issues, and if one family doc comes sick or is carrying COVID and gets to a whole bunch of people, it could really cause some problems. So I think we've all got to adapt, and I think the Academy is going to do a great job of putting it together. So
I'll let you share some closing thoughts here. If you were late, okay, first, why were you late, people? You should watch this. But my guest has been Dr. Mary Krebs, MD, FAAFP, Chair of the American Academy of Family Physicians Commission on Quality and Practice, also a solo family physician at a fairly qualified health center. Great conversation there, Mary. Any closing thoughts before we because I know you and we could just talk forever, but anything else for the audience to close things up that you haven't covered or that I didn't ask you tonight?
Just want to thank all of the, thank you and thank all of the AAFP staff, the OAFP staff, who are all working really hard behind the scenes to try to help us all adapt to a very crazy situation, a crazy and unexpected situation, and who are trying to advocate for us so that we can get what we need to take care of our patients. And of course, if you have the opportunity to join them, please do.
Cool. So very good. So I will ask Caitlin to bring up the resources slide to let people know here about our little sessions here, which have been going very well. So you'll see on your screen there. So there are some resource links, including the Everyone Project and COVID-19 information. And one of the coolest web pages, the Joy Among Chaos webpage. So if you haven't checked that out, check that out. And the Bite Size Learning webpage. So there have been past programs like this on that page. They'll be all archived there. And if you have any questions, you can contact Caitlin at the email address there. So thanks everybody for joining us. So next week, it's going to be even better. I'm going to give you a little preview for next week here, kids. So I will be back, and we will be talking about the OAFP Foundation with Drs. Keith Lehman and Penny Marchetti. So join us next week. And that's all for tonight. So thanks again, Mary.
Thanks, Mike.
We will stop the Facebook live, and we'll be good here. So let me know when we're free there, Caitlin.
I think we are off. I'll stop our recording.